Let's get into our special guest today. Her name is Dr. Joyce Harmon. Dr. Harmon graduated from Virginia Maryland Regional College of Veterinary Medicine in 1984 and became a member of the Royal College of Veterinary Surgeons in 1985. She's been certified in veterinary acupuncture for 14 years and veterinary chiropractic for a decade. She's since completed advanced training in homeopathy and herbal medicine and is currently working on a master's degree in Chinese medicine. Dr. Harmon has served as president of the American Holistic Veterinary Medical Association, chairman of the Alternative Medicine Therapeutic Options Committee for the American Association of Equine Practitioners, and has been a member of the Task Force on Alternative Medicine for the American Veterinary Medical Association, the AVMA. She's published over 40 papers in professional publications, given many lectures to professional audiences internationally, and was the team veterinarian for the USA East Endurance Team in the 1991 North American Championship race and for the gold medal winning team in Calgary, Canada in 1993. Since 1990, Dr. Harmon has owned and operated Harmony Equine Clinic, a holistic veterinary practice in Washington, that's in Virginia. We're honored to have her as our special guest today on Understanding CBD. So welcome to the show, Dr. Harmon. It's a pleasure having you.
Thank you. It's a pleasure being here and getting to share some of the most exciting news, I think, to come across the horse world lately.
Wow, that's a bold statement. We're definitely going to uncover that and get to understand more about this. Max and I really aren't horse people as we don't have a background with horses, so this is a lot of learning for us here as well. And first, Dr. Harmon, we're grateful for the work that you are doing with horses and animals in general. We really do appreciate it. And I don't know if it's common knowledge or not, but I recently learned that it's more difficult to get into a veterinary school than it is to medical school. Did you know that, Max?
That's actually still true.
Yeah, that is true. And, it makes sense because if you think about it, doctors will go in and they specialize on specific things, whether it's surgery or regular care or a dentist. But a vet is a one-stop shop.
They have to know everything.
They got to know everything.
Yeah.
Plus, there's anatomy of the different animals. I mean, if you're dealing with humans are all the same. But
right.
Animals, I mean, there's so many different types of animals that you're going to come across. So you got to be, aware of all those different things. Plus, they can't speak.
Patients can't talk to you.
They can't talk to you and tell you what's going on.
But they can't talk back either.
Well, there you go. That may be one of the advantages of dealing with animals. But that's really what we wanted to start the conversation with Dr. Harmon, which was what really sparked your interest in working with animals.
I think it was kind of a genetic thing because, as I recall, I was around 3 or 4 years old when I decided that I wanted to be a veterinarian, and I'm not sure exactly what triggered that. And for years, I thought I might be the first woman horse veterinarian. Little did I know that there actually were women horse vets way back then, but I just didn't know any, so I thought I might be the first.
Wow. Did you grow up on a farm?
No, I was actually born and raised in Washington, D.C., but I insisted that my mother take me horseback riding by the time I was about 4 years old.
So you always had a passion for horses. I guess that's what prompted the specialty in horses specifically.
Yes. Horses were my, and have been my life, love, soul, income, everything. And that did start for me at a very, very young age.
That's awesome. A lot of people don't even know what their goals are. I got 2 kids in college, and they're still, trying to figure out. Hey, look, I'm still trying to figure it out. We started a radio career, which we do have a radio career now, Max.
It's been a year.
In our late 40s.
Got a year of experience.
It's never too late. We're not all divinely motivated like Dr. Harmon here,
Yeah.
But you've accumulated so many different types of skills, and it's impressive your resume. Not only traditional but alternative. Can you help us out and define for us what is alternative medicine?
That's a great question and kind of a good way to start out because a lot of people get really confused about it. So alternative medicine or integrative medicine is really an umbrella term, and it means really almost any kind of medicine or medical treatments that are done that don't fall under the paradigm of drugs and surgery. And it's not that we don't need drugs and surgery at times. And so we sort of prefer the term integrative medicine, which means that we are integrating everything, the best medicine that you need that day. But underneath that umbrella, we have acupuncture, we have chiropractic, we have herbal medicine, and then we have Chinese herbal medicine, and we have Ayurvedic Indian herbal medicine, and we have American Indian and European herbal medicine. So we have many different sort of sub-branches. And then we have homeopathic medicine, and then we have many forms of body work, from simple massages to very esoteric types of medicine, energy medicine. The sky's kind of the limit, but it all gets put underneath the umbrella of alternative medicine. So if you take your dog for acupuncture, you are doing some alternative or complementary or integrative medicine.
And that's an impressive toolbox to have of different skill sets and different ways to actually help a potential patient. But what factors actually help you decide which method you're going to use when you first see a patient?
To begin with, you use the tools that you have studied and learned. And then when you get to be old like I am, you have learned a lot of different tools. And so you can look at an animal and say, what would be the most helpful here? And when you look at something like acupuncture, most of the time, the beauty of all of this is that we can treat many of our chronic conditions in all species of animals with the alternative medicines, usually better than we can with the conventional medicines. If you're hit by a bus, you really want to go to the ICU and the helicopter because they're going to do the best job. But if you've got some arthritis, your horse has some arthritis, your horse has some skin disease, your horse has some inflamed feet, there's all kinds of things that we don't have great drugs for. And the drugs have a lot of side effects. And most of our alternative types of treatments, they don't have side effects. And so we can use them safely for years in these older animals and really help them out. And so when I'm looking at an animal, I look at the fact that, say, acupuncture for arthritis, well, we're going to need to see you in a horse every month or so, in a dog maybe every week or so for a little while. And then if that doesn't work for the client, maybe we can do some herbs. Maybe we can do some homeopathic.
We're talking with Dr. Joyce Harmon, naturopathic horse veterinarian, many other skills to go along with that. And we're just started getting into finding out where hemp fits into the picture of naturopathic, traditional medicine, integrated medicine. And, you know, for the 3 generations of prohibition that's been happening, the plant has left many farmers trying to relearn the many uses of hemp. And historically, it was grown on every farm, but it's been some time. So the relationship between farmers and humans in hemp we're really learning about. But historically, Dr. Harmon, what is the relationship between horses and hemp?
Historically, actually, they may have used some of the hemp. They probably fed some of the industrial hemp to the horses just because it was good green material. But its use in the veterinary world really is fairly new, and that's really come about because the veterinarians were able to get interested in it at the same time that everybody else was sort of allowed to start growing it and selling it. And the veterinarians back in the early turn of the century paid a lot less attention to quality of life issues. And especially in the horse world, basically, if the horse could put one foot in front of the other, that was pretty much what they needed to do. We did have some sport horses back then, but it was mostly working horses. Now we have sport horses, we have beloved pets, we have horses in every discipline, and we have people who really pay attention to how comfortable their horses are. And CBD and hemp have really come to the forefront because, you know, there's no magic bullet in medicine, but CBD is one of the closer things we have to a magic bullet because it works on so many different systems. As you all know from the human end of things, humans have the endocannabinoid system that goes in almost every part of their body. Well, horses have it too, and so do dogs and cats and quite a few other warm-blooded creatures.
I want to get back to, so what do horses eat, and do hemp seeds and hemp seed oils play a role in their diet? Could they?
Yes. So hemp seeds have none of the CBD. So the hemp seeds are over here, and they're high in omega-3s and they're high in protein. And they have actually been used as animal feed for quite a long time, but they're not super popular. They're getting to be more popular. But for a long time, we couldn't grow hemp in this country, so we had to import hemp seeds from Canada or Romania or someplace like that. So most people didn't feed it to their horses, but it has been used as a food for years. And it's a very healthy food, and it's a wonderful, non-genetically modified source of protein. So that's the hemp seeds here. It's the CBD aspect that's much, much newer, and that's going to be your flowers and your buds that have the CBD in it. So if you grow hemp and grow it out and have seeds, you just have good nutrition. And if you take the flowers and the buds and you extract your CBD, then you have the effects on the endocannabinoid system. And horses are herbivores. Horses eat plants. That's what they do. They don't just eat grass. We think they eat grass, but if you watch horses eat, they eat all kinds of plants. And many of those plants that we call weeds are actually herbs. So horses naturally pick out things that are good for them. And horses will naturally gravitate towards eating hemp leaves if you offer that to them.
Interesting.
Yeah, I was curious about that, what they eat, and that definitely clears it up. I don't know if they're picky eaters or not, but the nutritional side of the hemp plant is always helpful, and we talk about that. We've talked about it on the show. I'm really interested in the cannabinoid uses that you've had. When did you start using the CBD or the cannabinoid rich flowers and buds from the hemp plant with horses, and why did you start doing it?
I started probably right around the time it became more legal, probably about 5 years ago, and did some studies. As an herbalist myself, I knew that horses would do well with it. I knew that there was tons of very healthy properties to the cannabinoids because there has been little bits of research that's been done. We just didn't have access to very much of the product. So as soon as I could, I'd get my hands on some. Then I started testing them on horses, one, to find out how much to feed, and two, to find out if it works as well in horses as it does in humans and in other species. And what I found is that horses, for the most part, love it. You do have picky eaters that won't eat anything you put in front of them. But horses, for the most part, do extremely well. They respond very similarly. And some of them respond with a fairly low dose compared to what we would think. We think, we have thousands of pounds of horse here. We must have to give, you look at your little bottle of CBD and you think, well, how can I possibly give that to a horse? A lot of the time we actually feed the CBD still on the leaf for the horses because they can digest that leaf and fiber perfectly well. They have a digestive tract that's adapted to it. So it's a little bit more economical to feed it while it's still on the leaf. But you can feed the oil as well, and some horses prefer the taste of the oil to the leaf itself. And many horses end up needing sort of 25 to 50 milligrams a day to have a really good response, or twice a day. And you can increase the doses based on what they are, how well they're responding, and whether you're getting the answers that you want from it.
Now, the assumption is that you would try that for a horse because the horse is experiencing some sort of pain. At least that's why a lot of people try CBD. So how does a horse actually convey pain? I mean, you see them pulling the carriages, their eyes look sad. I can't relate to a horse, but, there has to be a way that they, sort of show that they're in pain other than a limp or something. Is it something that you can determine?
Well, that's kind of the job both of the animal owner themselves and of the veterinarian. So the easy ones are the ones that limp. And you can say, yes, that leg hurts, and you can give them some CBD, and you can give them some CBD and find that they get better. That's sort of an easy answer, an easy fix. But horses really do have many, many ways of showing pain, and some of them are easier on the humans than others. Sometimes they just limp. Other times they deposit you on the ground in a heap because their back hurts. And sometimes they bite you. Sometimes they kick you. They can be very expressive, and they're very large, so when they express themselves, it may have repercussions. So you can also have much more subtle signs. I mean, animals can have a headache, and it's really hard to determine because it doesn't limp. And a lot of people for many, many years didn't think that horses really had back pain because they couldn't see it. But now we have gotten much better at recognizing it, much better diagnostic questions, and much better diagnostic tools.
Yeah, so when you have a horse that's expressing some discomfort, whether it's the limping, or you can notice that it's having some pain, and then you said, all right, I'm going to try to use some CBD on the horse. Do you always feed it to it, or can you use it topically?
You can use it topically, absolutely. You have a little bit of hair to contend with on the legs, but you can absolutely use it. And sometimes if you're going to use it topically, you might trim the hair around the joint that you're going to put it on. And especially in the wintertime, horses grow a lot of extra hair. And so if you want to put it on an area that's very hairy, you might want to trim a little bit of the hair off, or trim it down so it's not quite so thick, because the CBD is not the most inexpensive item. And so if you're having to put it on a ton of hair, it gets a little pricey. But if you put it on their skin, it works really well. Do
you find yourself using it more internally or topically?
I use it more internally because, and part of that is that so many times with a horse, you may have a joint that's a problem, and you can go and topically treat that. But then you actually have a lot of compensatory discomfort. So maybe one of their back legs hurts, but they also have been putting pressure on one of their front legs, and their back hurts. And so when you feed it systemically, then you're helping the entire body. And you'll see these horses that previously were kind of standing around out in the field, not really doing much, and now they're out playing with their buddies, or they're trotting across the field because they feel good, and their whole body feels good. And they're more cheerful, they're happier.
I read that arthritis is a common condition in horses, especially as they age, and treating the pain of arthritis. And so that's one of the top reasons that owners typically have to retire their horses. And how does hemp CBD help in that situation?
That's one of its biggest uses in the horse world, and one of its best, for sure. It is amazing. And people can often get more years of performance out of a horse. They can get better years of performance. So instead of having a horse that's starting to get old and you say, well, I'm just going to ride it around a little bit, do a little bit of trail riding. I can't really go to competitions anymore. I can't jump big jumps. And then you put them on the CBD and you find out that actually you have a few more good years of doing competitions, having more fun with your horse. And then when you do get to the really old horse stage, this keeps you from having to use quite so many drugs. And so you don't have the side effects. Horses have a lot of side effects from the anti-inflammatory drugs, and it can affect their intestinal tract. And horses do not have very good intestinal tracts. So the less drugs we can use to keep them comfortable, the better off we are.
Yeah, and there's a lot of conditions we want to dig into and get your opinion on as far as how you're treating horses with hemp CBD. But I wanted to get this question out of the way at least. And instead of treating specific conditions, being reactive, do you ever suggest that horse owners supplement and feed the horses hemp proactively or hemp CBD proactively?
Yes, I do. And I definitely have people who are interested in that sort of an approach. When we look at the research on having an endocannabinoid deficiency in humans, which is a thing that is being talked about these days, most likely we don't have the research to show that in horses, but we have a warm-blooded animal with an endocannabinoid system, and so we can really apply a lot of the research on CBD across all species. And so with the amount of stress, the amount of air pollution, the amount of everything that we live with as humans, the horses are in our same environment. Yes, they do live outside instead of inside, but other than that, they are breathing the same air, drinking the same water. And so I think that there is a real benefit in feeding low levels of CBD to horses as a preventative so that they stay healthier longer.
And low levels, you mean like 15, 10, 20 milligrams a day, or?
Generally, yes. If you're not having a big issue that you want to be treating, 15 to 25 would be a really good starting point.
Yeah, and you can either drop it in its mouth, or if you have the leaves around, you feed it to the leaves. So that's great. Well, we're here with Dr. Joyce Harmon, a horse veterinarian trained in a variety of methods for treating horses, and we're talking about CBD usage and how it can be beneficial for horses, just like humans and other animals. It's a big question we wanted to really get to, because there's good evidence that CBD can help with humans having seizures. Same for dogs. They can help with seizures. Is that a thing in the horse world? The horses have seizures, and is CBD popular for that?
Well, interestingly enough, horses they rarely have seizures. I have treated a number of horses with seizures, but they were really before the CBD days. It's a very difficult thing to treat in horses because they can be very dangerous when they are seizuring. But fortunately, it's really not very common. Where in the dog world, it's extremely common.
Yeah, while we're on the subject of dogs, so we know that THC, for those that don't know, THC is the cannabinoid in the cannabis plant that actually has a psychoactive or an intoxicating effect. We know that THC can be toxic for dogs. Is the same true for horses?
Truthfully, we don't totally know. However, it's not toxic in the same way with dogs, for sure, because it doesn't take very much THC to be toxic in dogs. Horses are probably more tolerant. However, they weigh 1,000 pounds, they have long legs, and you certainly would not want to be on top of a horse that had THC in it, because they may stumble and fall. And we do not know any safe dosing limits to THC in horses.
Gotcha. Well, it's an interesting question. I've been curious about that too. So one of the things we didn't really get to yet, we want to make sure to talk is with all the uses of horses now, especially in competitions and in the news lately, obviously drugging horses and trying to get an advantage, competitive advantage. How do competitions and the authorities look at the use of CBD on horses when it comes to competitions?
It is outlawed by the governing bodies, the main governing bodies in competition in the horse world, internationally and nationally. Having said that, if you're competing in these small local competitions where nobody's drug testing, you can certainly use CBD. And it's kind of sad that that it is outlawed, because if the people are going to try and find some way to make their horses more comfortable, CBD has a wonderful effect on the mind. A lot of horses are highly stressed, or a lot of horses have a lot of fear issues, and CBD is a wonderful, safe tool, a whole lot safer than trying to drug them with some psychoactive human drugs, which is part of what gets done, unfortunately. But if you are competing under rules, do not use CBD within 7 days of competing.
Yeah, it's nice to hear that the CBD does help horses have their quality of life, especially when it comes to temperament and distress, which I didn't really know that. So why do they ban the use of CBD? Is there a specific reason or is it just we just don't know about it?
No, the reason that most things get put on the list for banning is because they're worried about, one, giving a competitive edge to one person over another, but they're also worried about that it might enhance the performance and essentially, allow people to cheat, as some of the stuff that has come out in the news lately with people using drugs on horses to get ahead, to beat the other person. And so they're trying to level the playing field. Unfortunately, people are going to keep trying to go around that and are going to try and cheat some other way, and that usually involves more pharmaceuticals. And unfortunately, I think personally hemp would be one of those that should be legal, because it's very supportive to the mind and it's very supportive to the body.
Well, Dr. Joyce Harmon, we are very grateful for you joining us today. Unfortunately, we are out of time. We got to take our final break here and have our last segment. How do people get in touch with you for more questions, which I'm sure they have?
I have my website. There's a website called docshemp.com, and there's also a website called Harmony Equine, and my last name is spelled with an A, so it's Harmony Equine with an A. And there's contact information on both of those sites. And
you are still actively treating horses, right? You're with all the things that you're doing. You still are hands-on.
I'm still hands-on with the horses. Yep.
Well, that's great. Well, thank you again for joining us, Dr. Harmon. We really do appreciate it.